And good afternoon. Thank you for joining me again this week. Today we're going to be talking about two things that are very common that we see all the time here in the center. And so one of them is reflex disease, and one of them is type 2 diabetes. And so I've shown you this before, but I want to show you again. My book is falling apart because I use it all the time. This is from the Thrive in 63. This is a gut reset program that I absolutely love. So this is what happens when you have really good digestion. You have good digestion, you absorb your nutrients, you have energy repair, you have health. If you don't have good digestion, then you have toxicity, you have inflammation, and then you have imbalance. And you've got all of this sickness and disease, which pretty much encompasses everything that we could have. So having a good gut response is very, very important. And so one of the things that people come in and they talk to us about is acid reflux. And what most people don't know is that you can have acid reflux when you make too much acid, but you can also have exactly the same symptoms when you make too little acid. Most people don't know that. They go to the doctor, they say they've got acid reflux, the doctor gives them a protein pump inhibitor, and it does help with the symptoms, whether your symptoms are caused from over acidity or under acidity, but it doesn't solve the problem. So we want to go over a few things that have to do with digestion for you, because you may not understand this. My late husband had indigestion all the time, and we didn't know how to deal with it, and so he took the little pill and he was fine, so he thought. But that might have contributed to esophageal cancer, which is what he actually was diagnosed with, and he died from radiation poisoning, dealing with the handling or the maintenance of that disease. So we did not know this, and so it's really important. Most of what we do is education. We want to educate you so that you can make the best health choices. So how does the food get dissolved? How does it get put into a situation where your body can absolutely absorb your nutrients? Because if you're not absorbing your nutrients, then you've got a problem. So we're going to just do a little review here. Chewing and tasting foods allows the tongue to signal to the brain to prepare the stomach for digestion. The gut and the brain together decide how much gastric acid is needed to further the breakdown of food. Parietal cells secrete gastric acid until the pH of the stomach gets to be a 1 or a 2, which is very acid. Just so you have a comparison, hydrochloric acid, right, is a 1. Hydrochloric acid is what you have in your stomach. If you have a pool, and a lot of people here in South Texas do, then that acid that you wash your sidewalk with and all that kind of stuff is at a 1, a pH of a 1. So it's very acidic, it burns and that kind of thing. If your stomach acid does not go that low, then you're going to have trouble digesting your food. So the stomach acid gets to a 1 or a 2 on the pH scale. It liquefies the stomach content. When this occurs, the sphincter surrounding the duodenum opens up to allow the liquid contents to pass through to the small intestine. If this system works adequately, a moderate-sized meal would exit the stomach within 2 hours. So that means that you should, if things are working the way they need to, you should be having an empty stomach within 2 hours. Now, if that's not working right, if your stomach acid is not low enough, more acidic, because the lower you go, the more acid you get. If it's not acidic enough, then you're not going to break down the food. The food's just going to sit in your tummy, and you're not going to get any benefit from that. All right, so we don't want that to happen. So the parietal cells also secrete intrinsic factor. Intrinsic factor is important for you to be able to metabolize your food. If you have a sufficient bile, if you have sufficient enzymes, if you have sufficient flora in the gut, you're going to be able to digest and absorb your food the way you're supposed to. If you don't, then you're not going to. So if you have gastric issues, if you've got reflux issues, if you've got gas and bloating and that kind of thing, then there are things that we need to talk about. There are a lot of people who have had their gallbladder removed and they're not taking a digestive enzyme that has an ox bile supplement, all right? Bile salts are essential for breaking down fats. Your brain is made up almost totally of cholesterol, so you need fats to make your brain work. If you're not able to digest your fats because your gallbladder's been removed, then you're going to have a problem with that, all right? So we need to have sufficient enzymes, sufficient bile, and sufficient flora. Now, everybody over the age of 30 needs digestive enzymes. Why is that? Because most people, when they're growing up, they do a lot of junk food, they do a lot of comfort food, do a lot of fast food. Certainly here in the United States we do. And we use up all of the enzymes that we were born with. You have enzymes in your food if you eat a lot of raw food. So if you're one of those few people that eats a lot of raw food, then you're going to have more enzyme capacity than someone who has eaten the standard American diet, or as we call it, the SAD diet, standard American diet. All right. So if the bile and the flora and the hydrochloric acid are not at sufficient strength, then what's going to happen is your food is too large when it gets to the small intestines. It's not able to be absorbed. You're probably going to have yeast issues, which opens up the junctures of your gut, which allows food particles to pass into the bloodstream, which is what triggers autoimmune disease, and they call it leaky gut. So it's very, very complicated. So acid reflux, or the underproduction of acid, is really, really important. Now, if you get reflux on an empty stomach, that is a sign of over-acidity. Most people have reflux after they eat a meal, and that is a sign of under-acidity. So remember, the brain and the gut work together to determine how much acid is needed. So just think about this. Your brain is mission control. Your tongue tells your brain, we've got food coming, rev up the acid. The brain tells the tummy, we need to have more acid because food's getting ready to be swallowed, right? The tummy goes, oh, sorry, can't do that because I'm taking a proton pump inhibitor and I'm not making acid. The brain says, I'm not worried about that. I want you to produce acid anyway. And so you get into this vicious cycle of suppressing acid, the body trying to make acid, because the body's really, really smart. And you can get into a reflux rebound situation, which is not a good situation. All right, so we don't want to do that. Healing from reflux requires eliminating irritating foods, processed and refined foods, sugar, spicy foods, and alcohol can all contribute to reflux. Eating too large a meal or drinking too much water with a meal can also wreck digestion. So we have people that we know that will sit down to a meal and they will drink 2 or 3 large glasses of water while they're at that meal. That's not something that's a good idea because that water dilutes the stomach acid. And so when you dilute the stomach acid, you don't have enough to digest your food. So this is a problem. We want you to drink water before, like 30 minutes before the meal. That's okay. A lot of diet plans tell you to drink a lot of water before you eat your meal. You don't want to do it too quickly, too close to the meal, because you're going to dilute that stomach acid. We do want you to be hydrated, but we don't want you drinking right before a meal. We don't want you drinking during the meal. Yes, I have a glass of water with my meal. I do sip as I need to throughout the meal. I don't drink a lot of water until about an hour or so after the meal. Let my stomach acid do what it needs to do so that I don't have any issues, and I don't have any reflux issues. So that's a good thing, and I put it down to the fact that I have enough. Well, I still have my gallbladder, for one thing. I've never had any kind of gallbladder issues, and I apparently don't. I do enzymes because why? Because I'm over 30. Everybody over 30 needs to do digestive enzymes. So my digestion is pretty good. Consuming raw, fermented foods with meals, such as homemade sauerkraut, also strongly enhances digestion. If you are suffering from reflux, don't settle for the Band-Aid solution, which is your prescription. Get to the root of the problem. The protein pump inhibitor drugs are appropriate for those who genuinely overproduce gastric acid, but those drugs are meant for short term. I think in the packet insert it says no longer than 15 days. And I know people that have been on protein pump inhibitors for years. And so that's not what it was designed to do. That's not what the drug manufacturers wanted it to do. But we are creatures of comfort. We don't want to change. We don't want to give up our comfort food, whether that is spicy food or high fat content or high gluten content, whatever. And all of that damages our immune system, and it damages our digestive system, all right? So taking these proton pumps for years degrades the digestive vigor for someone not producing enough stomach acid. Clean up your diet and try some of the natural remedies. So what are some natural remedies? Well, you can put a couple of tablespoons of apple cider vinegar in a small amount of water. You can drink that before a meal. That is very acidic, and it will help with the hydrochloric acid in your stomach. Or if you're older, and older people have something called hypochloridria. All right, that took me a long time to learn how to say that word, and that just means low stomach acid. That leads to gastroparesis. Gastroparesis is just you're not able to process your food. Food moves through the stomach and the digestion very, very slowly because of low stomach acid. So there's all kinds of products that we can give you, like I said, the apple cider vinegar, or also something called betaine HCl will also help you with your stomach acid. So those are some things that you can try naturally and see if that just doesn't help you. All right, the other thing I wanted to talk to you today about is type 2 diabetes, because we have tons of people that come in, they're on metformin, they're on these other drugs. Some of them they even have to do insulin every day because their pancreas just isn't working and their blood sugar is just too high. So this was a study that was done at the Northwestern University in Chicago, all right? And so they found that there is a new way to reduce type 2 diabetes, and it's just easy, timing. It's all about timing. And what they found is that people who started eating in the morning before 8:30 a.m. lowered their blood sugar levels and had less insulin resistance. Now, these two risk factors can help reduce the risk of developing type 2 diabetes. Now, we know type 2 diabetes is on the rise. We know that obesity in the United States is on the rise. And so they found that if you would eat your breakfast before 8:30 a.m., you would drastically reduce your incidence or your risk of developing type 2 diabetes. So this is the study. It says, when the body doesn't respond well to insulin, the pancreas is producing, insulin resistance can occur, and glucose is less able to enter the cells. People who experience this will be at higher risk for type 2 diabetes. Insulin resistance and high blood sugar affects metabolism, which breaks down the food into proteins, carbohydrates, and fats. When these normal processes become disrupted, metabolic disorders such as diabetes can occur. Now, we know this. We know that obesity leads toward diabetes. We know that if you're obese, you're like twice as likely to become diabetic. And if you're diabetic, you're 4 times more likely to develop cancer. So this is a big deal in long-term health. So the doctors say, or the researchers say, that they found time-restricted eating has consistently demonstrated improvement in metabolic health. What is time-restricted eating? That is intermittent fasting. So people ask me all the time if I believe in intermittent fasting, if I like intermittent fasting, and yes, I do. I fast regularly for spiritual reasons, but also I do think that intermittent fasting, and I've done that from time to time, and a lot of people do the schedule of 12 hours. They'll eat their food within 12 hours, and then they won't have anything to eat for 12 hours. Sometimes people just have no food for 16 hours, and then they eat their food in the remaining hours, whatever that is. So you have to find out what works for you. I'm all for intermittent fasting, but I'm fasting for any reason, sensible fasting and that kind of thing. So in this study, the researchers analyzed data from over 10,000 adults who participated in the National Health and Nutrition Examination Survey. Participants were divided into 3 groups depending on the total duration of food intake. This included less than 10 hours, 10 to 13 hours, and more than 13 hours per day. So you had your intermittent fasting at 2 different levels, and then you had people that just ate whenever. They were grazers. I, most of the time, am a grazer. I'll have a snack in the morning, I'll have a snack midday, and then I have a big meal at the end of the day. That's mostly what my week looks like. On the weekends, we do intermittent fasting, so we'll have a lunch and we'll have an early dinner, and then a brunch and early dinner, and then we have a long time until we eat again the next day. And so on Sundays, sometimes we only just eat one meal, and that's just how it works in our schedule. So we practice a variety of timings, but what they did on this study, they had those 3 timings, the grazers, and then 2 different types of intermittent fasting. So the researchers then subdivided those 3 groups into 6 subgroups. What they found is that the fasting blood sugar levels did not differ significantly among the interval groups, so those that did intermittent fasting. So either they did the 10 hours or the 13 hours, wasn't much difference. But insulin resistance was higher with the shorter eating interval duration, but lower across all groups with eating time, a start eating time before 8:30 in the morning. So the grazers did not do well. They just did not do well on glucose metabolism. They don't tell you what you ate, okay? So most people, they'll get up and they'll have toast or an English muffin or pancakes or whatever. They start their morning with a grain, a carbohydrate. I'm not in favor of that. I want you to start your morning with a protein. If you start your morning with a protein, you're going to balance out your blood sugar, and you're not going to have that high glycemic spike that you're going to have with your pancakes or your bread or your muffin or your biscuit or whatever. Now, do I sometimes have a biscuit in the morning? Sometimes I do, but I'll make sure that I eat my eggs and my steak before, because that's going to be digested first, and that's going to keep my blood sugar stable. So we want all diabetic people to start their day with protein. You start with protein, and then you're not going to have that glycemic index spike, okay? They found that on all the groups, if you started your meal of the day before 8:30 in the morning, you had better glucose tolerance all throughout the day. So that's really, really important. The researchers found that the fasting blood sugar levels, okay, I said that. The study conclusion suggested that timing is strongly associated with metabolic measures. Researchers support early eating strategies for the risk of reduction of type 2 diabetes and believe that physicians should discuss these options with their at-risk patients. Now, this was a researcher from the National Sciences Academy in London. She is a dietitian, and she reported on that. So, continuing on that theme, what can you do with your diet besides starting your food intake before 8:30 in the morning? How can you maintain a healthy weight? Well, these are some things that you can add to your diet that are just real easy to do. A lot of times people know that if you are diabetic and you add cinnamon to your diet, that cinnamon helps balance your blood sugar. So we're going to talk a little bit about that. In 2019, the research was published that showed the results of systematic review and metadata analysis of cinnamon's effect on body weight, body mass index, waist circumference, and waist to hip ratio, and body fat issues, all right? The review encompassed 1,400 participants from 21 randomized controlled studies and found that cinnamon consumption significantly reduced body mass index, body weight, and waist to hip ratio. Now, we've talked about this before. You can Google body mass index. How do I calculate that? And it's height squared times weight or something like that. You can do that. They even give you a calculator. You put your height in, you put your weight in, it'll tell you where you are. An easier way to look at that is your waist measurement. For a lady, I think the statistics are if your waist measurement is below 34, you're good. For a gentleman, if your waist measurement is below 38, you are good. So the consumption of cinnamon will significantly reduce your body mass index. Body mass index is correlated with obesity and diabetes and cancer. So these are some things that we need to look at. What else can you do? You can eat dark chocolate. Now, a lot of people don't like dark chocolate because it's that little bit bitter, and yes, it is. It is my favorite. It has a lot of magnesium in it, so it's very good for your heart, but it also helps with your weight. So, where did that go? Yes. All right. Dark chocolate made from the solids and butter extracts of the cacao beans. These prize beans are actually dried fermented seeds of a small evergreen plant of Central and South America. Food-grade extracts from the beans include powders, nibs, butters, and solids, all packing enormous health benefits. When used in the making of dark chocolate, cacao, which is made from roasted cacao beans, may also help you fight obesity. In a 2018 study, the meta-analysis on these supplements found that dark chocolate reduced body weight, BMI, and waist circumference. So it doesn't get any better than that, people. You just get your dark chocolate and you're gonna have some good results with your weight and your hip to waist ratio, all right? Dose and duration were important determinants of favorable effects. When opting for dark, healthy chocolate, you have to stick with organic beans with at least 70% chocolate solids for the health benefits. So the higher your dark chocolate, the more bitter it is. But ladies, we can develop a taste for that if it shrinks our waist, right? Reduces obesity and stops the madness of leading to type 2 diabetes, okay? Citrus and citrus extracts. This also helps reduce your hip to waist ratio and your body mass index. We have even here at the clinic, I have made little roller balls with essential oil with orange and lemon and grapefruit. The ladies will put it on their wrist, diluted of course, and smelling that just helped them avoid the foods that they were not supposed to eat, and it triggered a higher metabolic rate, and so it helped them maintain their weight and even lose weight. So that's a good thing to look at too. A 12-week study with overweight adults found that supplementation with a citrus extract powder resulted in a significant reduction of body fat compared to a placebo. In a 2008 study, a citrus-based dietary supplement saw participants lose weight and reduce their overall body fat. So you can do it as a supplement. You can do it, as I said, as an essential oil lotion for your pulse points where you can smell it and that kind of thing. You don't want to do it neat. It's very volatile. You want to have it diluted in fractionated coconut oil, no stronger than a 10% dilution, which is those are the safety standards that we maintain. Green bean coffee extract also will help with that. Now, there's been a lot of hype about that. And green bean coffee extract is coffee beans. They just haven't been roasted. So it's nothing magical. It's coffee, but it hasn't been roasted. And so they take the extract of that, or they dry them and they put them in a powder, they put them in a supplement, and they did some testing on that to see kind of what they did. So these beans are loaded with antioxidant compounds called chlorogenic acids, and raw green coffee beans may help you with your weight loss efforts. In a 2020 review and meta-analysis on the studies of green coffee extract, all right, it measured adults' found, this was in adults that were overweight, found that the supplements, the supplements had a beneficial effect on body weight and waist size. So your body mass index also was reduced. The researchers determined that the green bean coffee extract peptide was safe, cost-effective, and a good alternative to the treatment of obesity. Separate analysis reviewed in randomized controlled trials found that green coffee extract found in supplements improved obesity indices, including BMI in obese people and overweight individuals. To gain the maximum benefits, supplements had to happen for at least 4 weeks. So it wasn't something that you would do one day on and not even pay attention to it. You're not going to get an overnight result. But if you take it for at least 4 weeks, you would see that result. Soup. Okay, I don't know about you, but I don't really like soup in the hot weather. I like it in the cold weather. But the study found that soup can help you lose weight. In a 2020 meta-analysis sought to determine the mechanisms of the association with soup and weight loss when they reviewed almost 2,000 individuals, 2,000 scientific articles and 7 cross-sectional studies on soup consumption and obesity. Incredibly, all the studies in the review indicated a significant inverse relation between soup consumption and obesity. For optimal weight loss and health benefits, focus on soups with fresh, whole ingredients, not the processed and canned varieties. Well, I think you knew I was going to say that, right? You want to have a lot of chicken, organic, vegetable stock, miso, organic beef. They're all highly nutritious, and they satisfy what you need nutritionally, but they help you lose weight as well. The 6th thing that they talked about was spirulina. Now, spirulina is a blue-green algae, and it is a superfood. I wouldn't necessarily say that it tastes great when you take it by the spoonful, okay? But we've got a great powder that has spirulina in it. It's got the superfruits and the superfoods in there, and it's very, very tasty. It's a great way to get your spirulina, but they found that spirulina is a nutrient that has really, really good results in maintaining and reducing your body mass index. So modern science has revealed that it may also be an ally in fighting obesity. So nobody tells you that. When you go to the doctor and the doctor says, Mrs. Jones, you need to go home and lose some weight, he doesn't say, go home and eat some spirulina. Go home and put some cinnamon in your food. Go home and try some coffee bean extract. Go home and have some dark chocolate, right? So it would be really helpful if we knew these things, because all of us at one time or another in our lives, we fight excess weight, we fight body mass index that may be a little bit higher than ideal. These are some tasty ways that you can deal with that without having to resort to a drug that has side effects, and these are some things that you can incorporate into your lifestyle. Remember that Hippocrates said, let your food be your medicine and your medicine be your food. So that's it for me today. It is the weekend. Take care of yourself and get some self-care, whether that means reading your favorite book, going out in the sunshine, going down to the beach, going to the mountains, whatever floats your boat. I want you to do that because you are worth the investment in yourself. I will see you again next week. Take care.